Hi, everyone. Welcome. We'll get started here shortly. Okay, we have a lot to get through today. Let's go ahead and get started. So thank you again for joining us today. I'm Jenny Sheeter. I'm the Director of Public Health Data for Big Cities Health Coalition. Next slide. So Big Cities Health Coalition is a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of more than 62 million people they serve. Together, these public health departments directly affect the health and well-being of about 1 in 5 Americans. So we have partnered for many years with the Urban Health Collaborative at Drexel University to provide hard-to-find city-level health data to our colleagues in public health and to the public at large. In today's webinar, you'll hear how this data is put to use, some practical examples of how cities can galvanize data into action that improves the health of their community. So if you would like to explore the platform for yourself, please visit bigcitieshealthdata.org, and that link will be put in the chat as well. So for more about our speakers, I'm going to turn things over to our colleague at Drexel, Amy Auchincloss, the Associate Professor in the Department of Epidemiology and Biostatistics. So Amy, take it away.
Thanks. Sorry, I think I'm on the, hold on. Sorry, technical. Hi, everyone. Thanks so much for joining. We're all very excited to have our great health department partners here sharing their work. So my name is Amy Auchincloss. I'm the lead epidemiologist and supervisor for the data platform, and I'm here with my very talented colleague, Simon Niamatullah, who's the lead senior data analyst for and manages the platform. Thank you so much to the 36 local health departments that Jenny already mentioned. Atlanta is actually a new member. We don't have their data on the platform yet, but we have all the other city data on the platform. And many of you have been partners and providing data over the years, and we really appreciate it. All your contributions. Thank you to our funders. This is supported by CDC, and a disclaimer that the views and content is not is determined by the creators, and the views expressed here don't necessarily represent those of the CDC or the US government. So before we get started, just to let you know what is different about bigcitieshealth.org compared to other data platforms. So we have city level data. It's newer data through 2024 for the most part, and many more metrics, about 125 metrics versus most platforms have very few metrics, and the ability to look at subgroups and time trends. So we have race ethnicity subgroups for many of the indicators and trends going back to 2010. So questions and comments, please put them into the Q&A at the bottom of your Zoom screen, and we may answer some questions live during the session, but many of them will wait until the end of the presenters. So thank you so much to our outstanding health department colleagues. And our first up is from Denver, Paige Andrews and Ryan Curtis. So I'll turn it over to you.
Wonderful. Thank you, Amy. All right, I'm going to share my screen real quick. Okay. So yes, as Amy mentioned, my colleague Ryan and I are going to chat briefly about a dashboard initiative that we've been working on that we really drew inspiration and a lot of help from the Big Cities Health Coalition data platform. which is what I just said here in this overview. So we'll jump right in. We'll try to move quickly to make sure all of our colleagues have enough time to talk about their projects. And if anyone has any questions, please put it in the Q&A. We'd love to chat more. So kind of some context and background about this dashboard that Ryan has really been amazing in developing for our team is it's all kind of began when our Denver Department of Public Health and Environment were thinking about what a population health program would look like and what some of our goals would be. And it was really driven by these two questions about, how do we begin to understand the condition of Denver's health opportunity and equity, and how do we really undertake that process with our community partners and with our community members. So they were really, integral in both the design and the outcome of that process. So as we began to dive in, we were really lucky that the timing just worked out and things really overlapped exceedingly well with our community health assessment. So quick plug, if anyone's interested, you can scan that QR code or visit that link. And we really had an incredible partnership with the assessment design team as part of our community health assessment. And this assessment design team was a group of community partners. We were about 12 members with over 50% membership outside of our health department that really went through and tried to determine which indicators would be most important to represent Denver's health and well-being. And that is really what led us to our indicator selection to get to our dashboard. And as part of that process, we definitely referenced the Big Cities Health Coalition dashboard to help us figure out how do we understand health and really get down to the nitty gritty, but also comprehensively consider indicators for our CHA and beyond. So we were really, really proud that kind of even the selection of the indicators as well as the then diving into the results was done alongside our community partners. So we thought we would just highlight quickly kind of what it looked like to interact with the Big Cities Health Coalition dashboard during this process. So some highlights we wanted to call out about the Big Cities Health Coalition data platform is that it really is an incredible resource of population health and well-being indicators. We were looking at models across the country and found 5 or 6 that we really felt matched our goals of like highlighting health equity and health opportunity and social determinants of health, and also giving a good comprehensive understanding of well-being, especially at the population health level. And this tool was certainly one of them. Something that was extremely helpful for our team is that the data is downloadable, and we found the technical documentation very helpful. It always included a little justification piece as well as like why this indicator was selected, which we found great as we were trying to do our narrowing down process for figuring out what indicators should go in our dashboard. And then I wanted to call out some additional points. So for the racial segregation indices, we really love also the county health rankings and roadmaps dashboard and all the data they have available. But they only have the white and black racial segregation index. And so seeing more breakdowns included in this dashboard was really helpful to our team. They also had a really unique heat and disaster measures in the Big City Health Coalition dashboard. And it was also really helpful as we've been kind of in tandem going through our own chronic disease assessment and figuring out how to best represent that on the dashboard that Ryan's going to show. So it was helpful to look at the indicators that were included in this platform as well. We also just wanted to call out some specific additions that our dashboard has in case it'd be helpful to any other folks who are interested in kind of like referencing these great resources and also creating a product specific to their jurisdiction. So we did, get to add our YRBS Colorado version of the YRBS is called Healthy Kids Colorado Survey. So that data we were able to add, as well as information from like our hospitalization data that's specific to Denver and Colorado, as well as an all payers claim database, similarly like purchased by our health department and very specific to our area. As well as other like city and state specific resources, such as we have an incredible food team here at the Denver Department of Public Health and Environment, and they put out a food insecurity survey that we're able to reference and include information, as well as, for example, some state partners do a really good job at looking at racial differences among juvenile arrests that we were able to include, things like that. Um, in addition, we love the demographic information available on Big Cities Health Coalition, but when we did have a little more information that was available, we could dive deeper in the dashboard. And I will kick it over to my colleague Ryan to talk about a little bit more.
Yeah, thank you so much, Paige. I'm Ryan Curtis. I've been working on the development of this dashboard. Paige has kind of been the brains and the main driving force behind a lot of this stuff, but we are super excited to share what we've got so far. But before that, I wanted to talk a little bit about kind of our next steps and how we're utilizing the platform and BCHC data and all these things. One thing that's super nice is that we've recently API access to their data, which is really exciting. A big access, it's easy to use, all these sorts of things. And we really want to just have everything centralized and easy to access and use. And being able to pull from an API to automatically update these things is going to be huge for keeping things up to date and tidy, cutting down on manual labor, all these kinds of things. We also, since we've kind of taken a lot of liberties with the indicators that we've chosen, we've got some more refined, like census tract data available where possible. So we're really excited to incorporate that and add maps in when possible. And as far as next steps, we have a couple more rounds of feedback that we'll talk about a little more, and then we will be publishing to the public once we can, which we're really excited about. So I will go ahead and hijack the screen share so that I can show y'all where we're at with the dashboard. And I will do a pretty quick walkthrough. We don't want to take up too much of everyone's time here. And I believe my internet connection is a little unstable right now. Perfect timing. So bear with me if I'm cutting out. Happy to repeat if needed. Just let me know. So here is what we're looking at for our community health dashboard. We wanted to take like a very kind of public forward approach to this. So we've got a couple different buttons. You can see it's definitely not in its final stage. There's a couple things we're still tweaking. And we are getting there, but we're not quite at like the final stage of it. So we've got like a little frequently asked questions page we can incorporate here if we need, where people can get more information on how to use, how to access, how to see these things. We've got like a data usage and definitions page. So this is for all of our indicators, where they're being pulled from, what demographic they're being pulled for, all these different things. So if someone's a little more data savvy, they can come in here, they can access the data directly and come in and view it and see where we're pulling it from, or play and download it themselves. And then we've also got a download page that people can use and interact with to actually come in and just export this data as like a huge Excel table if they want to do their own visualizations or more refined explorations and these kinds of things. So a lot of different ways for people to interact and use this data. We just want to make it as open as possible. Obviously, this is all line level aggregate data, so none of this can really be traced back to anybody because there's a lot of concerns about data usage and sharing agreements. So there's been a lot of data use agreements in the creation of this, and that's kind of where we've landed, is just a lot of aggregate level stuff. We've got these separate, I guess you could call them health categories. That's kind of how we decided to separate our indicators. So when we pop into one category, we'll just choose health behaviors here. We've got our selected indicator up here. For example, right now we're on firearm access for high school students. You can see the total change over time, right? So we've got 2021 data and 2023 data. You can see some metadata about where it's from, when it was updated, what kind of units we're in, how they defined the question. We can switch to any of the other indicators we've gotten here too. If we want to look at something like alcohol use, right, we're going to have a little more data surrounding that. We've got, this is like an AI generated summary that we're working with within, it's called Snowflake for our online databasing. And we're leveraging some of their tools to make like an AI summary of these things so that people who aren't as data savvy or as number savvy can still get really helpful input on these things and still glean the same information. So this is still being tweaked, but it's something that we're working on for the time being. Down here, we've got demographics right? So up at this top is like kind of the total changes over time. These are demographics. So this right here is a yearly snapshot. And then down here, we can see demographic changes over the years. We're working on getting more aggregate data throughout the years. So right now we can only see 2023 for this particular indicator. But if we come over to a different one like diabetes prevalence and we come down here, you can see we've got years and years of data so people can see those changes over time. And if you've played with the BCHC data dashboard, you'll see a lot of similarities in how we designed things. We wanted to make it really easy and intuitive, which we thought theirs was. So having like a way to select indicators and visualize changes over year and see these things was huge for us. And we took a lot of inspiration in how they built their tool to inform how we built ours because they had created such a great product that we wanted to do something similar, but just on our own city and county level. And just to keep things brief, I will probably stop it there. I can really quickly go through these other pages. They all look the exact same. It's just different indicator categories. So you've got different kinds of data in here. Eventually, we'll be adding more indicators and things as we go through. But that is where we're at for now. Once again, it's not quite in its final rendition, but we're super stoked with where it's at for the time being. And we're really excited to continue to get feedback and eventually publish it for the public consumption.
Thank you so much, Ryan and Paige. That was great. Can you give us a quick, what's the timeline? I know that things can take a while to get approved, but as far as you guys are concerned, when is it going to be finished and when would you ideally like the public to get access?
Yeah, I think we are currently the last big thing we're talking with a lot of like internal teams just to see what kind of indicators they have. We want this to be like a resource for the public and also our providers and our teams and these things. So our next big step is we're taking it to like our internal leadership, I believe next month to kind of get their eyes on it. And probably that will hopefully be the last round of feedback before we can really publish it and say, hey, it's ready here. We'll put it on the public, put it out for the public to view. Anything to add, Paige?
Sorry, Ryan, I was answering a question in the chat. I'm sure you said was spot on. Sorry.
Perfect.
I'm answering your question now, Elise.
How
Sorry.
long would you say it's from start to finish, just so that others who want to replicate something like this can have a bit of a reality check? Is this a couple of years in the making, or what would you say?
Yeah, I would say from like start to finish, it's probably been about a year and a half. But a lot of that was because we really did a really slow kind of intentional community-based process to decide what indicators would initially be included with our community health assessment, which I really recommend that part of the process. It was wonderful, and we can definitely talk more about that with folks if they're interested. And then there were some other gaps in there. I took maternity leave for a little bit, and there were some other things going on. But yeah, that did take us a while.
All right. Well, thanks so much for sharing. It's really interesting work. Next up, we have Houston Health Department with Tolu Olumuyiwa and Nashid Farzana. Thank you so much for joining us and sharing your experiences.
All right, good morning. Can you hear me?
Yes.
Excellent, excellent. All right, so this morning, Houston is going to be presenting some of the ways in which we use the platform data. My name is Tolu Olumuyiwa, as Amy had said, and my colleague as well is on here, Nashid, and so we'll be sharing how Houston uses this data. So here, quick facts about Houston. We are a large city. The metro population has about 7 million people, but within the city itself, we have an estimated 2.3 to 2.4 million people. We do like to believe that we have the largest medical center in the world and also the world's largest livestock rodeo show. So we thought we'd share some fun facts about us. On the right of the screen, you will see Houston State of Health data portal. It is majorly used by stakeholders, both within the city, but also just across the department. And we many times supplement data from Big Cities Health Coalition with the data from Houston State of Health portal as well. So do check it out. Next slide. So just a bit of an overview of where we sit. My team sits within the health department. So we do have a public health infrastructure division at the health department, but across the department, we do have multiple data teams looking at data in different ways. So our team is the Office of Program Evaluation and Research for Effectiveness. And so we do a lot of population health data analytics, community health assessments, program evaluation. And so you will see in the next slides how this data from the platform serves the work that happens within our team. So we have used platform data. So when I say platform data, I'm referring to BCHC platform data in the past couple of years. In fact, according to my boss, Dr. Banerjee, she's used the platform since its inception as our director or as one of the founding members of the coalition. So it's been interesting to see us continue to use it through time. More specifically, we did use it directly within our Houston community health assessment in 2024. We've also used it multiple times when we are describing, just challenges faced by urban cities, writing problem statements for grants, communicating with senior leadership, but also stakeholders outside of the department. So those are some multiple ways in which we have used the data. Next slide. All right, so here is to the right of my screen, you can see that's a screenshot from our community health assessment where we cite directly from the BCHC platform. So this is looking at life expectancy at birth. We also talked about showing through show trends. If you look at the chart below, which is one of the things we really like about BCHC's platform, is the ability to, look at trends, compare cities with similar sizes as Houston. So that's one of the things we really like about the platform. More specifically, in recent times, we use this data in our recent maternal and child health assessment. We did have to do a landscape analysis for maternal and child health programs across the city. And so one of the things we did look at was we wanted to compare what cities had just similar stats as Houston. And so, of course, we went to Big Cities Health Coalition platform. And so once we identified the top cities, we didn't stop there. We actually then reached out to the cities, saying to them we had seen the data from big cities, and we wanted to have some additional conversations about, how they were using their data to inform some of the programming that they were doing at those levels. So it was helpful that we didn't just stop at looking at the data. We actually dived into some additional analysis with additional conversations with these health departments that then led into our own strategic planning for maternal and child health. So we really did like that, even though we started as just looking at data and comparing data, but it ended up just going into more translational public health and helping us build relationships with these other health departments. So more specifically, we looked at indicators like teen birth, infant mortality, low birth weight. All of these indicators eventually fed into our MCH strategic plan for the health department. Next slide. All right, so in terms of how we plan to use this moving forward, we asked our colleagues within our team. So like I said earlier, we do a lot of assessments, strategic planning. And one of the feedback we've gotten is that it will be helpful to see the data at a more granular level. Right now, we know that it's place data, so cities, but it'll be interesting to see how we can, dive deeper, particularly looking at zip code level data. For large cities like Houston, there's a lot of disparity just across the city. And so just looking at city data is not enough. We're hoping that in the future, we'll be able to look at zip code level data so that we can have more targeted interventions in terms of, our programming and the work that we're doing for Houstonians. We are also hoping that we can compare trends. So for example, if you are looking at like leading causes of death across categories. It'll be interesting to look at motor vehicle related deaths versus firearm related deaths to better understand some of these relative trends. Also looking at life expectancy by smaller areas. I mentioned zip code level earlier. And then just looking at how other health departments are using the data, I think will be helpful as well. Next slide. So lastly, it'll be interesting. We've been doing a lot of work about just addressing homelessness within our city. And so it'll be really nice to see like point in time count for homeless populations. And if there's anyone on the call who's already doing that, it would be really exciting to hear how you all are doing that and if you're sharing that data. We are also looking to see air pollution metrics. We do see, we've seen data that kind of just talks about it on a large scale, but in terms of just finer scale community exposure, long-term trend, I think that'll be interesting and more actionable. And then just lastly, I think seeing how other places or other areas have leveraged on this data, how they are using it, what types of, I think what has come out on the other side, not just from a data standpoint, but how data has informed action will be helpful as well. So like I had said earlier, when we saw how we compared with other cities, we then reached out across to our colleagues across those cities, and it ended up in just informing the work that we're doing. So I think just highlighting some of those stories so that we're not just looking at the data, but also talking about how that data is translating into action will be really nice to see. So that's how we've used the data. Please reach out to us, and we look forward to just hanging around and answering any questions you might have about Houston. Thank you.
Thank you so much. Thank you, Tolu. Thank you, Nashid. Thanks so much. You guys are doing terrific work, and I see some colleagues in the chat that want to join up with you. So hopefully this will be another networking opportunity. I wanted, before we turn over to Michelle, I just want to quickly show that, yeah, Houston, we do have homelessness. We have the point in time data here, which we spent some time collecting. So please do take a look at that. And Houston actually has some of the numbers have gone down. We have vacant housing, owner occupied, and for some cities we have vacant housing versus homelessness. And we also have air pollution, poor air quality, hazardous air quality.
Amy, you're not sharing your screen.
Oh gosh, I'm so sorry. Yeah, so we have some of these indicators, homelessness, air quality, that are on the platform. So do take advantage. You can see, for all of you, you can see the metric list here, which you can scroll through, or you can put filter by categories, or you can just start typing in here, and some of the search functions will work as well. So great. Sorry to interrupt, Michelle. We're looking forward to your presentation. So next up we have Cleveland, Department of Public Health, and Michelle Wilcox.
Thank you, thank you. So I just have to toggle for 1 second. Are you able to see my screen?
Perfect.
Excellent. Afternoon, everyone. So my role in today's conversation is to really take the baton that the epidemiologists have set the stage for, and just show you in real life how I leverage the data from Big Cities Health Data Dashboard, that platform that is amazing. I leverage it in my everyday work with policy and advocacy. So just a brief agenda. I'm going to do a little bit of level setting just so you can get a better understanding of the work that we do at the Health Equity and Social Justice Division, which is housed in the Cleveland Department of Public Health. We are City of Cleveland government employees. So just giving you that big background there, and then talk a bit more about the IET, which is our interdepartmental equity team, and is made up of a lot of amazing partners across the city of Cleveland who are housed in various departments. And the health equity impact assessment tool that we use. So I'll give you a little bit more insight into that. All of these moving pieces and parts we're able to leverage the Big Cities Health Coalition data platform to inform the work that we do, and specifically for me as the only policy analyst at the Cleveland Department of Public Health at the moment. So level setting with HESJ and IET, I love to show this framework for folks who haven't seen it, folks that have seen it. I really hyper focus on the policy part of this framework, given the role that I'm in, but also the reason why I came to this work. I started off in healthcare for 20 years, and I did the work there. So I'm new to the team as of next month, it'll be a year. But I'm not new to the work when it comes to advocacy and policy. And so this is always a great framework to showcase during my time in healthcare and now in public health, that all the things that we're all trying to solve for, that we're trying to support our community members on, all starts with the foundation of system, which is informed by policy and procedures and processes, and all of that is informed by humans. So I love to have that framework to just do a little bit of level setting there, because all the work that we do in health equity, social justice is about systems change through the policy procedures and processes. And we work with humans to get this work done so we can ensure that we're supporting our folks well. Going into this slide here, which is our strategic plan for 2024 to 2027, we're actually in the process of revitalizing that. We'll be starting that soon, and we're definitely going to be using BCHD to help inform the work that we're going to do moving forward, leveraging their data to inform our indicators. I want to share with you all a little snapshot of what leads our work at Health Equity Social Justice in support of our mayor, Mayor Justin Bibb. So for our mayor, it's vitally important that we do the work that we do and improve the systems across the city of Cleveland to ensure the folks that we serve, we're serving them well and we're not causing them harm, unintentionally or intentionally. And so this graphic is a great one because I like that it really touched on the equity and the justice piece. Justice is often missing out of the graphic. So this whole snapshot of the individuals needing to gain access to a vital nutrient, which is a fruit, vital nutrient. What does it look like to get the support they need so they both have access to nutrients so they can live well? So I love that snapshot for folks to get the full picture of it. And in essence, it's a great graphic to showcase what our work is really about. All right, so rolling into the health equity and impact assessment and the IET indicators. So our IET again is made up of various departments at the city of Cleveland. And so we got some amazing folks that have served well in these different roles. And we come together as the IET. Our team leads the work. We support the work. We do all the administrative work behind the scenes to support the work that they do in their roles. Our role is really about the foundational component of ensuring that folks have what they need as they interface with the city of Cleveland through all the various services that they need to receive. So we work on improving our systems internally and partnering with our stakeholders externally to work together to all improve the health and well-being of our city of Cleveland residents. And so what you see on the screen is a snapshot of a portion of our IET strategic plan that informs our health equity impact assessment. So the top overarching focus, this is actually one of the work groups that I lead, the Built Environment and Neighborhood work group. We have the overarching vision, which is the result of ensuring that all Cleveland neighborhoods have what they need so folks can live well and live well long. And then it's various indicators. I don't have them all on the screen for this specific work group, but I wanted to give you a snapshot. So as you can see, one of our indicators is tracking the monthly RTA ridership, We also track the percentage of residents who have access to healthy food options. We track our city park equity score and many, many more indicators. Then we also have a work group called the Equity, I say so much, the Safety and Community Supports Work Group. And their overarching vision is to ensure all Cleveland residents live in a safe community free from violence. So what you see below there is some of the indicators they track for that group. And then we have the Economic Mobility and Stability Work Group. They focus on, their end goal is focusing on ensuring that all Cleveland residents live within 15 minutes of an anchor institution and community resource that will help them achieve economic mobility and stability in Cleveland. And you'll see below one of their indicators shared on the screen. And then last but not least, our fourth work group is health and public health. And their vision, if you will, is to ensure that there are no health disparities between neighborhoods in Cleveland. And if you're aware of anything in Cleveland, there is this, it has been historically a Cleveland East Side versus Cleveland West Side division. And so oftentimes the West Side has more resources available than the East Side. And so over the decades, we have been working to ensure that equity is made reality, and the East Side of Cleveland has just as many resources as the West Side of Cleveland. So their work is to ensure that that is done, and they follow those indicators that are on the screen. And now rolling into how we leverage real life application. I'm big on real life application, showing folks now that we have the foundation, the backstory of what we do, what does it actually look like to put this data that BCHC has beautifully created into practice to help us do our work well? So and again, foundationally, in all the work that we do with the Health Equity Social Justice Department is to ensure the systems are working well for everyone that we're privileged to serve as public servants. And so leveraging BCHD and others, but right now we're hyper focusing on the amazing work that you are doing because your city, you have the city level data, which is very hard to gain access to. Anybody working across any level of advocacy, policy work, systems change, working in the city, in the county, we know that neighborhood level data and city level data is extremely hard to acquire. And so I really, really appreciate, because we could not do this work, as you see, of getting to the end goal of health equity. We cannot influence policy and, the various measurements that we're tracking, which are the indicators, and shifting programs to better serve people, to strengthen our infrastructure without having solid data that we can access that's readily available. So I just want to share with you what it looks like in a system that we are currently using. It's called Clear Impact. And that platform is where we house all the various data that we collect to track these indicators over time. So one thing I want to point out, if you notice at the 15-minute full service grocery store indicator, the last available data we had was 2022. And because of that, there was no comparison data, because it was a great project that was started, but when leadership change and or team members change and priorities change as a result, then this wasn't, unfortunately, it wasn't picked back up in a way to track this specific indicator. And that happens across the board, not just with this indicator. So it's important that we have platforms like BCHD to be able to showcase a snapshot. And what I'll show you shortly, they have a great snapshot to help us track that data. Making sure I didn't skip a slide. Okay, so when I go to use BCHC's platform, their data platform, I immediately go to Cleveland. I love how they have that snapshot over there to the right to give a little brief overview of Cleveland for folks that aren't familiar with it. And then I go right to the metric that we're trying to find. And so what I want to show here is that as soon as you do the drop down, you will see what it is you're looking for. And I mean, I think Amy said they have 195, if I'm not not mistaken. They have so many indicators that you can track. It's not even funny. It makes your job so easy when it comes to actually getting the work done because you don't want that barrier of you being able to do quality work in the community because you don't have access to readily available quality data. So I love that they have what we needed, which is the food. I got so excited when I seen it. The food access data with the limited supermarket access, which aligns with the data I just showed you that we were tracking. So I was able to leverage what they have available. And I believe it was a 10, 11-year snapshot that I could add to our resource to help make the business case. And in addition to that, I just want to show you that they have all of this other great information that informs our other indicators that we're tracking. But again, as we tee up our next round of our strategic plan with the indicators we're going to be tracking, having this information readily available is an easy win because we can at least say that, hey, we have access to it. So we can track this and see if we're making some progress or not in that area. And then this is just more of a snapshot of some of the indicators that they have data that they have readily available that align with the indicators that we're tracking. And then I also wanted to show you all how I look at the city to city comparison. Amy did it briefly, and I wanted to just show you for the various indicators we track internally as a team, and then also with the various hats that I wear externally and partnering with our stakeholders. I serve as the chair of a local maternity mental health coalition or a committee that's a part of a bigger coalition. So leveraging that data there, I serve on a committee where we're doing um, violent prevention and intervention work. Uh-oh, I'm sorry. I got interrupted. Let me know when you can see my screen again, Amy.
I got it. You're there.
Okay.
Good.
So sorry, y'all. But when I look at the work that I'm doing, I'm looking for quality, readily available data. And so being in partnership with the groups where we're focusing on violence prevention and intervention, I'm able to have access to that data. And again, with the limited supermarket access. So just wanted to show that. And then lastly, when it comes to advocacy and policy, hopefully you can see my screen there. With advocacy and policy, I wanted to showcase this. When looking at comparing the city to city, and I should have mentioned it here, if you notice, I pulled up the data for Chicago, Cleveland, and Detroit across all of these various indicators. And along all of them, you see the trend. I'm often looking for trends because I then have to make the business case as to, is this a one-off or has this been happening over time? And I can compare to comparable cities to showcase that, hey, this is working in our area, this is not working in our area, we're ahead, we're behind, this investment is needed, so on and so forth. So for Chicago, Cleveland, and Detroit, the trend is pretty similar across the board until you get to the one on the right-hand side where we're focusing on vacant housing and homelessness. And this was as of 2024. You see that Cleveland is not doing as well compared to the other cities. And so what I marked here is there's a clear difference between Cleveland's data versus Chicago and Detroit's data, I should say. So when you look at the amount of vacant housing units per homeless population, we're not doing well in comparison to Chicago and Detroit. So what I marked there is with me following various pieces of legislation in public health that impacts the health and well-being of City of Cleveland residents, I have been following the Road to Housing Act for a while throughout this year in particular. And knowing that it just Congress officially signed it into law, I know that there's opportunity coming down once they determine how the resources will be allocated. So we can get ahead of it because I've been tracking it and I'm seeing the data that BCHC has available to make the business case that, hey, comparable cities to Cleveland are faring well. What's happening with Cleveland? This is an opportunity to advocate for more resources compared to other states and cities that may have the issue, but ours is exceeding for whatever reason. I know it's a myriad of reasons. And those of you that work in housing know it's a myriad of reasons. But to close it out, that's essentially how I leverage the data to make the business case of ensuring that we have increased investments in the city of Cleveland neighborhoods. And then lastly, I just want to share that these are all the many ways that BCHC help support the work that I do, that many others on the call have shared today. The platform is just amazing. I'm so grateful that it was put on my radar earlier this year, and I've been telling everybody about it. So, Amy, don't be surprised if you get more folks on board. They're not necessarily part of the health department, but they're a part of the public health work. So you might have uptick in usage from the city of Cleveland or the Cuyahoga County partners. So just sharing a little snapshot. This is all the ways that I use it in my work. Other partners use it in their work. This is what we do at HESJ, which again is housed in the Cleveland Department of Public Health. And that is it for me. Thank you for the time. Feel free to reach out to me at any time and ask me any questions. If you are fellow advocates and policy analysts and just anybody that's boots on the ground trying to make an impact in your neck of the woods. Thank you, Amy.
Thank you. Thank you so much, Michelle. It's such a gift to have somebody who really does policy work on the ground here and talking about their perspective. That's one of the kind of gaps that actually the Houston team highlighted when I was meeting with them, that sometimes there isn't a clear link to policy and what actually can be done with the data. And so your contributions are really helpful in that regard. Yeah, does anyone have you're getting some love, Michelle, in the chat, and some of the others as well. Anyone want to open up to, we got a question from Elise Wallen to Paige and Ryan out of curiosity. You might have already, Paige, did you already answer that? I didn't keep track of some of the things you were answering already.
Yes, I tried to, but please at
Okay,
least let me know
great.
if I didn't speak to any of your questions.
Great. Thanks. Anyone else? I can also, while we're waiting, I will just share for a second. This is just to remind folks so the home button is, is anything up? You can select your city here or just select explore a city. And again, this is just the 36 cities or 35, we don't have Atlanta yet, of the Big Cities Health Coalition platform. Just to show here, for example, Cleveland, all cities, we can look at homelessness, for all the cities together, and also vacant housing. This metric is a little, this gets to what some of you all are probably grappling with, how your readers and audiences are interpreting things, and maybe it makes it some of the way we present may make it a little harder. But homelessness is heavily driven by SES in the city. So I think we can see Denver is way up, should be up here. Yeah, Denver is way up here. New York, San Francisco is the highest. Denver is among the top 4 homeless rates in the country, with Cleveland at the lower end because of gentrification and all the costs that are coming around when folks are making a lot of money, that when it's raising the cost of living and housing for example, in New York, San Francisco, the .com booms in there. So Detroit, El Paso, some of the cities that are lower SES have much less homelessness. Not to say that it is not a problem there, though it is. And this is just so folks can see, this is the sort from city name, and also you can sort by city name like we hear, and then look at the vacant housing to homelessness. So vacant housing to homelessness, ideally, the number, actually we want the number to be high because that means that there's more vacants per homeless. So it would build a case that, hey, there's all this vacant housing, why not get people in it? It's like, don't hold on to that housing. It's just sitting there. It's just real estate that's sitting there empty. Whereas places like New York, the vacancy rate is so low that there isn't a lot of room to go. But places like Memphis, Milwaukee, Dallas, they're sitting on a lot of housing that is actually vacant that people could be living in. So yeah, there's a bunch of ways to look at things. You can look at it pulling down the Compare Cities tab, 5 cities. You can select whatever cities you want, and then of course selecting the metrics. So things like violence and injury as a category. We can look at injury deaths over time. You can look at that stratified by race as well. And by looking at the trends in injury by race, and then download. All of these data are downloadable for image as well as the table, and then technical documentation and the download. There's a full download button here where you can actually download much larger chunks of the data. Great. We have a question. Gosh, was I not sharing?
Oh, yeah.
You were sharing. We
I
heard
was
you.
sharing.
Yeah, you
Okay.
were.
But now what happened? I'm not sharing, right? Did I stop sharing? Yeah.
Yeah, you did.
And we have a question that came in. Do you want to take yourself off mute, or are we Tolu?
Yeah, it's me, Amy. It was just regarding what you just shared. So in the vacancy to homelessness, there was no data for Houston. So is it no data or is it
I
just
think we didn't
the
have the vacant.
you
There
didn't
was
have
some
that one?
problem. Maybe it
Okay.
wasn't the vacancy data, because we do have the we do have the we do have total homelessness for Houston, but it was the other.
The other chart.
Yeah, when we go to sort by city name. Yeah, that was, so it must have been the vacant housing that we didn't have for
Okay.
the period that we were looking at.
All right.
Um,
Thank you.
There's a question in the chat, Amy.
Do you want to say it? Is there an answer?
Yes, I
Please
think
share projects that have occurred because of the city health. Is that one?
no, sorry. Is there any plan to add tobacco related metrics?
Tobacco related metrics. Good. That's a great question. We are unfortunately a little slim in that area. We do have, so we have some of the outcomes. We have lung cancer deaths. We have adult smoking. That's from the BRFSS. Many of you already have better data than this is from the Places data set from the BRFSS on the right. And the left is the NVSS vital statistics data. So we have some of the outcomes. We have cardiovascular deaths, lung cancer deaths, some chronic disease outcomes. We don't have a lot on the behavioral end. It's just from the BRFSS. And then we have the teen smoking. But that, as many of you know from the YRBS, maybe in your jurisdiction as well, is not, there's some of the data have not continued to be collected, and also is missing, unfortunately. And the relevancy of this is also mixed because of the vaping. Vaping is now maybe a stronger metric in some communities. But yeah, your ideas for, I know there's a great tobacco work group that BCHC has. If you're not already part of that, please contact Jenny and join up. You maybe are already one of the leaders, whoever asked this question, in the tobacco work group. But yeah. Anyone else?
I think
Simon, can you take it?
Well,
Yeah.
I was going to say, while people are thinking about their final questions, I do want to thank everyone, but also we want to put up a poll quickly to let us know the usefulness of webinars such as this. So that will be coming up shortly. If you could fill that out, that'd be helpful.
Does anyone have anything else? We got we had a question from the registration around some other examples in addition to what you guys have shared, that where they have used the Big Cities health data platform. Wanted to share, I'm not sure Shreya is on the line, but she shared last year about using the platform. And I just put that into the chat. The Long Beach has used the data platform as a data source for some of their health equity metrics. Particularly, they pulled the race stratified data, I think, which weren't readily available at their city. So they pulled that from the platform, and she pulls that every year for populating their platform. And a bunch of folks have used it for the community health assessment.
Amy, I wanted to add real quick. This is Houston, that we recently used it in an access to care report. And it was interesting because you had 2024 data for access to insurance, Medicaid coverage or insurance coverage. I don't remember what the metric was for teens under 19. And in other sources, we didn't find a more recent data set. So that was really good. Thank you.
Great. That comes from the that comes from the census data, right? The 5-year, essentially a moving average, but it's a snapshot, 5-year snapshot for city level data. So that's the census 5-year estimates are a high demand. A lot of people are pulling that from this platform because we compile the data as soon as we can. Usually the census closes out the year in December or so, and we start compiling it, and then annually we update the platform in around April.
So before we leave, I do want to say thank you to Amy. She is retiring, and this is her baby for BCHI. So do want to thank you and appreciate all of your work. It means so much to everyone that's joining. So thank you, Amy, for all of your time.
Thank you. Thank you. It's been a pleasure.
All right. Well, thank you all. Thank you for joining. A special thanks to Amy, and enjoy your next chapter. All right. Thanks, everybody.